This is Dr. Meyer with our weekly video blog. This week I'd like to talk about medical marijuana. Marijuana is a very controversial drug with federal laws totally outlawing it, and some states have laws now that permit it for medical marijuana. And in Sacramento, for instance, all the dispensaries have been closed when the federal agents came in and closed them down. The ones inside Sacramento are still operating, but not the ones in the county. All the states have different laws, and the principal difference between medical marijuana or smoking marijuana and nicotine is rather significant. Cigarette nicotine is one of the most addicting substances known to man, and therefore people have difficulty stopping that. And there's different state laws as when you can start smoking, and I think it's probably 18 in most states, some maybe 21. The longer you hold off on that, the better you will be, because once you smoke from, say, age 16 or 18 until your mid-20s, you're pretty well addicted, and it's very difficult to stop smoking. And, you know, in my business of lung disease, it's a big part of the business was people get more and more lung cancer. And, you know, and get emphysema, obstructive lung disease. And the correlation there was dramatically brought home to me once when I had a patient who had bad emphysema, very short of breath, couldn't walk across the street hardly, but she couldn't give up her cigarettes, and she was in her 80s. And she came in for a yearly x-ray, breathing tests, and things just got continually worse. And then one day, on the annual chest x-ray, I put it up and I spotted a nodule, a mass on her x-ray. And I says, it looks pretty serious. And she says, could be cancer? I says, well, it certainly could be. And then she smiled. And it was very confusing to me as a young physician. Why would somebody who's thinking about having cancer of the lung smile? And I says, what's going on here? And she says, well, now I know it's going to be over with before too long. She's suffering, and she thought that the emphysema was far worse than having cancer and dying. And so this is the dichotomy we have here in our specialty, and so we treat people with emphysema, who has asthma, bronchitis, and so on, and then the cancer, and both of these give significant pain. And this was brought home to me when I had a patient here a couple of years ago who had lost weight down to, I think, in his close to 60 pounds or so, full-grown man. He had far advanced emphysema, and then he developed some infections, and he almost died in the hospital. And his weight dropped from, I think it was around 160 down to about 80 over the course of that 9 months. He was finally able to go home with the assistance of home health care, and but he wasn't able to leave his house for almost a year. He was too short of breath to even walk across the room, and he was just totally cared for by his wife, for whether it's food, his medication, his treatment, his breathing tests, and his medications. And he could not even walk to the kitchen. It took almost half a year for him to walk about his house. Interesting thing there was he's so short of breath he couldn't keep a court appointment. So he called the judge and says, you know, I've got emphysema here, and I'm so short of breath I haven't been able to get out of the house for almost a year. Can we do this by phone? And I was surprised. He did his whole court proceedings. He did his cross-examination on the phone of the witnesses, and he won the case. And that to me was quite amazing that he could do all this at home, and being so totally disabled he could hardly walk, but he was able to talk on the phone. But what changed him was that he was on Marinol, and that was started in the hospital, and I continued that. required a narcotic license like I have, or all doctors essentially have. And we wrote for his Marinol, 5 milligrams a couple of times a day. That improved his appetite, and he started eating, and he gradually regained his weight from 80 pounds until I saw him last time in his home. He's up to about 160 pounds, and he could actually walk out into his front yard. And so I had a little different opinion of marijuana then, but it's not really marijuana, it's the drug. It's like taking a narcotic, and it's very well controlled and requires a prescription and a narcotic type prescription. But this has shed some new light on is marijuana appropriate to be sold to the public. Well, there's many side effects and mental effects on marijuana. The brain cannot totally mature if you start it too young. It's almost like a hallucinogen at times, and has significant effects on your brain, and some feel that the brain cannot develop normally if you're on marijuana at a young age, and so some people have suggested that it be sold to the public, but the age should be 25, or where most people graduate from college, they've got their brain working pretty good, and they understand the odds, and they're not going to be the people who get what we call potheads, where they smoke a lot of marijuana every day. And if they're 25 and they understand all the complications, they've got their brain pretty well educated, they're on significant good goals in their life, that might be a time that it could be made more public and sold publicly. Now, I haven't decided whether this is a good course, because selling it is a whole lot different than prescribing it. Although right now the marijuana is basically prescribed by those doctors that are interested in this. So the issue is still up in the air, and that still has to be resolved. And so that's it for today. Don't forget to subscribe to my channel, and be sure to post your comments and questions in the section below. So until next week, this is Dr. Meyer. Take care.